And I'd like to introduce Dr. Mike Catchpole, who is Chief Scientist at the European Centre for Disease Prevention and Control, ECDC. He has a long track record of management of surveillance and response for communicable diseases. And he's going to introduce us to a vision for a global operations room. Mike?
Thank you, and thank you to the organisers for inviting me to talk. Excellent set of presentations, really good presentations this morning about how we might predict, plan for emerging, perhaps prevent. But the reality is, we're never going to prevent everything. And if you think about it, the disease that we most reliably predict is going to cause a major pandemic problem, it's influenza. And we even have plans for how to respond to it. But despite all that, when a pandemic happens, we need a coordinated operational response. And I'm going to talk very briefly about a vision for how we can move to an even more global arrangement for responding to these problems. So I'm just going to rush through the first few slides, but just to make the point that infectious diseases are truly a global phenomenon. They cause concern, panic, disease, and have major public health impacts around the world. I'm talking about a global operations centre. Why global? Because we live in a global society, and that's a point's been made so many times over the last 2.5 days. But as Kofi Annan said, arguing against globalisation is arguing against the laws of gravity. We need global responses to infectious diseases that do not respect borders. And this just simply shows a map of international transport. The point here is that you can move from one side of the globe to the other in 24 hours or so, i.e. less than the incubation period for most infectious diseases. And this just shows perhaps one of the most recent examples, which is MERS coronavirus, how the significant outbreak that we've seen in the Middle East, particularly in Saudi Arabia, has resulted in cases in many other parts of the world, not just Europe, the USA, but of course also in South Korea. So how do we respond to such incidents? And I should also mention, of course, we're talking about food, plants, and as well as humans. This is a map just showing the supply chain investigation that was undertaken as part of the investigation into the E. coli outbreak in Germany, which resulted in many, many cases of severe illness and deaths. And this just shows the complexity of supply chains that we have to deal with when responding to major outbreaks. So why an operations centre? I really like this quote from Scanlon. It was an investigation into the role of EOCs in emergency management in America and Canadian experience. And Scanlon's comment is that an EOC, an emergency operations centre, is an effective way to achieve coordination amongst agencies responding to a major emergency or disaster. The absence of an EOC seems to encourage the opposite. But why do we need such cooperation? Well, I think it's simple, that actually most major emerging infectious disease incidents require a multi-sectoral, multidisciplinary response. We are talking in this meeting absolutely about the interface between human disease, animal disease, diseases of plants. It inevitably needs an intersectoral response. Part of that response and that coordination is about effective communication and the sharing of accurate information in a timely manner. And that, I would say, is at the core of the function of an operations centre. There was a report earlier this year, the World Health Organisation's EOCnet meeting, which looked at what are the general and public health functions of an EOC. I'm not going to read through this list, but I mean, it's about command, it's about planning, it's about logistics, and it's about communication. Those are the general functions, and then a range of public health functions that may be more or less specialised depending on the type of incident you deal with. And I think the challenge for us is particularly that right-hand list, because we don't know what types of specialism we're going to need to rely on until the event occurs. And the core principles for operations, for a global operations centre, it must be based on an all hazards approach. It needs to be modular, scalable. It needs to support joint engagement of multiple jurisdictions and organisation in management decisions. There have to be clear lines of accountability. Integration, interoperability with partner agencies, and there must be clearly defined roles. These again come from the WHO EOC Net meeting report, but I can say from my experience, I led the EOC in London at the beginning of the pandemic response. I've been involved in many other major national responses, and these points ring absolutely true. When we would need one? Well, I think probably the easiest definition for when we might want to invoke a global operations centre is when we have a public health emergency of international concern as defined in the international health regulations. What would I say are the prerequisites for success of a global operations centre? Well, it clearly has to have a mandate to do what we're asking it to do. There has to be trust. We're talking about an operations centre that will have a command and control function. That needs plans and procedures, it needs staff, it needs excellent information management systems, communications technology and communications infrastructure, and regular training and exercises. So it's simple. Those are the prerequisites for success. Of those, I would suggest that the mandate and trust are the most important, or at least the most difficult to achieve, or will be to achieve. If we look at mandate and trust in terms of an international context, well, probably the key structures, documents, international agreements I would point to as providing a mandate for a global operations centre are the international health regulations and, of course, the Global Health Security Initiative. And in the context of that, the World Health Organization has a really key role. Now, that's looking very much at the global perspective, but we are here in Europe, and I would just like to sort of add that within Europe, we also have our own structures and decisions that would be important in terms of mandating an international, if not global, operations centre. So we've got the EU decision on cross-border threats, 1082. We have a health security committee, which would be brought together to deal with emerging threats. And we have a number of agencies. I just pick 3 here that were most likely to be involved in the kind of emerging threats that we're talking about at this meeting. There need to be plans and procedures. There are many national preparedness plans for influenza. There's a global preparedness plan for influenza. But I think we heard, and I was very struck by Bill's comments earlier about we need to map out, we need to predict, and we probably can predict what many of the emerging threats will be. But if we're to have a global operations centre that's going to deal with that full range of threats, we need more than just a pandemic plan for flu. We need staffing. This is actually the Emergency Operations Centre in the first few weeks of the flu pandemic in the UK. We need staffing. There needs to be very clear roles and responsibilities set out for the staff in there. We need to be able to call upon staff that have this range of public health expertise. And it needs to be 24/7. Now, information is absolutely the heart of an effective operations centre. This is a model of how the European Centre for Disease Prevention and Control, where I work, ECDC, gathers its operational intelligence. We have a range of more traditional indicator-based surveillance systems, collection of data from national notification systems, mortality monitoring, a variety of other routine sources of data, which are collected and analysed and statistical reports produced in the traditional way. But increasingly, event-based surveillance is becoming a key part of epidemic intelligence. So that is the monitoring of less formal and less traditional and less structured sources of data, media sources, news aggregator sources, ProMed, for example, as under professional sources, it requires filtering and validation, which is a significant process. But these two sets of data are brought together, and that ultimately we can identify threats and track what is happening with them. So this is actually the ECDC Operations Center. We meet every morning at 11:30, and we review the sorts of data I showed on the last slide. And this is what would need to happen in the Global Operations Center. Whether it's in peacetime or in the face of a response, you need that daily monitoring of a wide range of information sources if it's going to be an effective coordinating center. What will it look like? Well, this is just a floor plan of an operations center. It actually comes from the UK, but it makes the point that you need to support a wide range of functions. But I would argue that actually if you think about the range of different problems that we're going to face, the global nature, the need for international coordination, that a global operations center is going to have to be a hub and spoke arrangement where you have experts and those responsible for operational aspects of the response based in different centers, quite often in different countries, but all connected through a central hub. So whether we think of the Global Operations Center as simply that hub at the center, or the totality, which is, I would argue, is how we need to think of it, I think it's unlikely that we'll have a Global Operations Center that simply sits in one place, say Geneva, for example. And in fact, in Europe, we already have that model. In Europe, we have 3 of the major directorates that have responsibility for dealing with emergencies and responses. Each have their own coordination centers that in an emergency work together. So DG ECHO has the Emergency Response Coordination Center, but DG SANTI has the Health Emergency Operations Facility, and DG Home has the Strategic Assessment and Response Center. Now, each of these have specialists and expertise and support information networks that will look at different aspects of an emergency response. And I think this is the way of the future, that when we talk about a Global Operations Center, it will be a networked center. So what are the challenges? Perhaps it comes back to the criteria for success, but I think that the first challenge is establishing that clear mandate, that clear idea that there will be leadership for responses. We need to secure staff and information system resources, and those staff will need to be available on a 24/7 basis, 365 days of the year. We need to achieve agreement between sectors on a concept of operations. You will find that many organizations have very good concepts of operations, very good operation centers, but actually there's dramatic incompatibility between them. We need common criteria for when we would activate an operations center, when we would scale up, and I'm sure many of you will remember the flu pandemic, the question about when we were going to go, when we were going to DEFCON 1 or whatever the right phrase is. And equally, it's quite difficult to decide when you're going to de-escalate a response. There's a lack of standards and operability of public health emergency centers, as I said. There's ineffective communication of operational information and collaboration among and between EOCs and response teams. I think there's plenty of evidence for that. There will need to be a directory of available expertise. This will need to be an all-hazards operation response center. And there will need to be regular international interagency exercise. They take a lot of preparation, but they are essential to effective working. And if we just look, I've just got a couple more slides here. If we look at, and this again is taken from, some of this is taken from the WHO report, some is taken from other reports. If we look at issues in the management of emergency responses, issues that have been seen time and time again: lack of leadership, lack of coordination, lack of integration, lack or loss of resources, lack of planning, lack of media support. I believe that if we can identify, define and set up a global operations center, actually it will take us a long way to addressing these or avoiding these in the future. That actually having an expert focus of leadership, having a priori plans and good communications, having a clear overall command and control structure with a clear mandate, which should hopefully allow the securing of resources, and clear and consistent communications and a highly visible coordination will address many of those major issues. So we've talked about global operations. What's next? Perhaps we haven't yet got to the point where we have to think about an operations center on the moon, but who knows? So with that, I'm afraid that was a really rapid run through an operations center. But as I said, it doesn't matter how good we are at predicting, how good we are at planning for the next major pandemic. When it comes, and it will come, we need to be working together to deal with it. Thank you.
Thank you very much, Mike, for this very interesting and clear presentation on a blueprint for an global operations room. I think for many cases where animal and plant health issues are the case, it might be helpful to control the outbreak in a very early stage. So I think elements can be used. But one critical point that I think it will often happen is when to feed the control center with the right information to start with. Are there any technical questions? One or two from the room, please.
Magid Yunus, formerly WHO, so I think you know me from there. No, just a couple of things. I think it was really a very interesting presentation. And I was intrigued, of course, by the list of lacking issues that we need to address. But maybe one of the things that we need really to think about and be revolutionary, having retired from WHO, I can say it more openly, is the fact that the problem we're having is fragmentation. Fragmentation of the response of the health sector because of the structure of WHO with regional stuff. The fragmentation of the response of the international organizations. We tried to address that through tripartite work. Jan knows about it, of course, quite a bit. Also the lack of staffing, but something that is really has been frustrating WHO a lot is the fact that there is a lack, and of course FAO and others, is the lack of support by member states for such an operation. So do you have any solution to all of these issues?
That's a nice, simple question. Thank you. My view is that, I mean, that's true at a global level, but I would argue that actually it's not so very different at national level. That when you're talking about, now we've moved to an all hazards approach in the context of international health regulations, and with the cross-border threats decision in Europe, there is a very clear need for intersectoral response, both at a national and an international level. So what I would say is, from my observations of what is happening at a national level, is that the first step is a recognition of the need to address the points you've made. The second is to actually develop plans together and then to exercise. Now, those are non-trivial exercises, all of those, but that's the way I would go about it, is that you build up from, you need to work together, you develop the plans, you exercise it. Now, I take the point about the resources for WHO, for a global operations center. I mean, there is an enormous amount of expertise around the world, and with few exceptions, when we do have a global health emergency, it will tend to be focused on one part of the world rather than the other. And that's where I think what we need is the international community to actually bring resource to bear. We saw it happened eventually in West Africa, but I think eventually is the right word to use there. And, you know, but we've seen it happen, and it can happen again. And I think also the idea of an operations center is a network where actually you don't have to necessarily physically remove people from one side of the world to the other in order to be effective operators in operations center may also help with that. So we don't necessarily have to have everybody sitting in Geneva or sitting in Brussels to do this. What we need is really good communication systems, so we've got a virtual operations center.
Okay, thank you very much.